What to expect before your PET scan? Getting ready for a PET scan can seem a bit overwhelming, but knowing what to expect can make the process much smoother. If your doctor has recommended a PET scan for lung cancer diagnosis or staging, there are some important steps to follow to ensure accurate results and your safety. First, you will likely be asked to fast for about 4 to 6 hours before the scan. During this time, only water is usually permitted. Fasting helps lower your blood sugar levels, which is important because high glucose can interfere with the radioactive tracer used during the scan. You might also be advised to limit carbohydrate intake for a day or two before the test, sometimes following a low-carb, high-protein diet to improve the quality of the images. It's very important to tell your healthcare provider about all medications you are taking, including over-the-counter drugs. Certain medicines, especially those for diabetes, need special management because they can affect the scan. Your doctor will give specific instructions on how to handle your medications on the day of the test. Be sure to mention any allergies, especially to contrast dyes, and if you think you might be pregnant or are pregnant, as this can influence the procedure. On the day of your scan, plan to arrive about 15 to 30 minutes early. When you get there, a small Roman 4 line will be inserted into your arm. Through this line, a tiny amount of radioactive glucose, called a tracer, will be injected. This tracer emits gamma rays that the scanner detects to produce detailed images of your lungs and other tissues. After the injection, you will need to rest quietly for about 60 minutes. During this waiting period, avoid moving around or engaging in physical activity because it can change how the tracer is distributed in your body. The actual scan involves lying still on a narrow table that slides into a large, tunnel-shaped scanner. The procedure is painless, but the table may feel cold or hard. If you feel anxious or claustrophobic, talk to your doctor beforehand. They might prescribe a mild sedative to help you relax during the scan. If you take a sedative, arrange for someone to drive you home afterward. Communication with the technologist is possible throughout the scan via an intercom, so if you need anything, just ask. The scan usually takes about 20 to 30 minutes, but the entire appointment, including preparation and waiting, can last around 2 to 3 hours. After the scan, you might be advised to avoid close contact with pregnant women and young children for several hours because of the radioactive tracer. It's also helpful to bring any recent scans or medical records, especially if you have had previous treatments or surgeries, as this information helps the radiologist interpret your results accurately. In summary, before your PET scan, you should plan to fast, manage your medications carefully, and arrive prepared for an injection of a radioactive tracer. Rest quietly during the waiting period, stay still during the scan, and communicate openly with your medical team. Proper preparation helps ensure the most accurate results, which are vital for diagnosing, staging, and planning treatment for lung cancer. Always remember to follow your healthcare provider's instructions and ask questions if anything is unclear.